It is a high-stress morning ritual for thousands of patients. The moment the clock strikes 8, the race begins to secure one of a limited number of GP appointments before the phone lines go silent. The bottleneck is driven by a growing, aging population with increasingly complex medical needs, all funneling into a static number of local surgeries. However, high-street community pharmacies have evolved to provide a clinical alternative, moving far beyond the traditional role of a retail dispensary. This framework document for the Thames Valley area shows a network of 328 community pharmacies operating across Berkshire, Oxfordshire, and Buckinghamshire. Through direct partnership with local GPs, these pharmacies function as a coordinated clinical network, triaging specific groups of patients to ensure they receive specialized care while reducing the daily pressure on the surgery's front desk. To maintain this flow, the system identifies specific patient groups for diversion. The first is the acute and urgent cohort, people suffering from sudden minor illnesses. Under the Pharmacy First framework, NHS 111 operators and GP receptionists route these patients directly to a pharmacist rather than booking them into a doctor's consultation. As detailed in the Advanced Services section, pharmacists can now independently treat 7 common conditions and supply necessary medication without a doctor's prescription. This includes locally developed initiatives, such as the Minor Ailment Service, designed specifically for low-income families in East Berkshire. Diverting these minor issues to the high street allows patients to receive clinical attention the same day, while reducing the total number of routine cases entering the GP surgery. The second group is the chronic and preventative cohort, which includes patients requiring long-term health monitoring. Through the Hypertension Case Finding Service, pharmacists proactively check blood pressures, identify undiagnosed cases, and feed that data directly back to the GP for further action. The support also moves the other way. When a GP prescribes a new medication, the New Medicine Service allows the pharmacist to monitor the patient during those initial weeks to ensure they are managing the treatment correctly. For those with stable, long-term conditions, electronic repeat dispensing allows the pharmacy to manage ongoing supplies without the patient needing to call their doctor for every refill. This tag-team approach identifies severe chronic issues early while keeping stable patients out of the GP waiting room. The third group is the transitional cohort, patients moving from the intensive environment of a hospital back to their own homes. This transition is a high-risk period. Confusion over new hospital medications frequently leads to accidental harm or immediate readmission. The Discharge Medicine Service provides a safety net. Its primary goal, as stated here, is to optimize the use of medicines and reduce harm during these transfers of care. This ensures continuity. For example, a smoking cessation program initiated on a hospital ward can be seamlessly picked up and managed by the local pharmacist once the patient is home. By identifying medication errors immediately after a patient returns home, these pharmacies provide a critical check designed to lower the risk of avoidable hospital readmissions. When GPs and community pharmacies collaborate this closely, the entire local health ecosystem becomes more efficient. This model allows for a more effective division of labor. Because pharmacies are handling routine, stable, and transitional cases, GPs are able to dedicate their time to severe, complex medical diagnostics. These pharmacist-led teams provide clinical support across the week, using their extended weekend hours to offer a high level of accessibility to the public. Routing a patient to the pharmacy ensures they connect with a specialist equipped to handle their specific needs, bypassing the general queue for a targeted consultation. This is the modern NHS, utilizing existing high-street infrastructure to deliver rapid, specialized care right on the community's doorstep.